49-year-old female with abdominal pain. CT scan of the abdomen showing thickened and enhanced gallbladder wall with adjacent fat stranding. Thickened and enhanced gallbladder wall with adjacent liver enhancement. The adjacent hepatic parenchyma shows enhancement, which is mostly due to inflammatory reactive change. Inflammatory reactive change. The gallbladder itself is not collapsed, okay, and there is no gallbladder stones. No gallbladder stones, and it's not collapsed, okay. Next finding, this is associated with periportal prominent lymph nodes. Can you see the periportal lymph nodes? These. So this is associated with prominent periportal lymph nodes. Next finding is perihepatic and right paracolic free fluid. So the thickened gallbladder wall is associated with perihepatic free fluid. Can you see the perihepatic free fluid? And right paracolic free fluid. This is the right paracolic free fluid. And if you go up, this is the perihepatic free fluid. Can you see the low attenuation liver? This is the low attenuation liver compared with the spleen. This is consistent with hepatic steatosis or fatty liver. So here, this is the normal hepatic attenuation compared to the spleen, of similar attenuation to the spleen. However, here, the hepatic attenuation is less than the splenic attenuation, consistent with fatty liver or hepatic steatosis. So here we have fatty liver or hepatic steatosis along with thickened and enhanced gallbladder wall. And if you go down into the pelvis, can you see this patient's uterus? The patient uterus is very bulky. Bulky uterus, most likely fibroid uterus. Okay? Also, this patient chest shows minor bibasal reticular changes. Minor bibasal reticular changes. Okay? Next finding is L1. This is the first lumbar vertebrae. This is the last strip Okay, and here this is the T12 vertebrae. After that, the first lumbar vertebrae. This is the first lumbar vertebrae, showing thickened trabeculae, thickened vertebral trabeculae, giving the polka dot or salt and pepper appearance of vertebral haemangioma. So this patient has L1 vertebral body haemangioma. So the findings here are thickened and enhanced gallbladder wall with adjacent fat stranding and adjacent hepatic parenchymal enhancement. Okay, and adjacent hepatic parenchymal enhancement and periportal prominent lymph nodes and perihepatic free fluid, perihepatic and pericolic free fluid. This is the pericolic free fluid. All of these findings indicates acute cholecystitis. So the interpretation here is acute non-calculous cholecystitis, as there are no gallbladder stones could be detected. However, isodense gallbladder stones could be present and can't be detected on CT scan. That's why in the management, this patient needs more radiological investigations, more ultrasound. This patient needs ultrasound of the abdomen to confirm whether this patient has gallbladder stones or not, which is important in the management. This must be confirmed before surgical referral of the patient, before referring this patient to surgery, okay, for the appropriate management. We need to confirm whether this is acute calculous or non-calculous cholecystitis.